Today I want to talk about revision of the gastric bypass. So a lot of our patients have had a gastric bypass. I've been doing gastric bypasses for about 20 years. And we've done about 10,000 patients just here at Mather since I started this program about 20 years ago. And out of those, there are at least 2,500 bypasses that I've done in this, in our facility here at Mather. So some of these patients, have done fantastic. Most of them have done fantastic. Some patients have regained weight, of course. And when a patient regains weight after a Roux-en-Y gastric bypass, it's usually because they're eating very frequently, or they're eating carbs that's making them hungry, and they're therefore eating more frequently. And this is a form of dumping that can cause these kind of symptoms. So we can help these patients. So if you're one of these people, it would be very helpful if you came and saw us. We could really help you in various ways. So the first way that we use is we do nutritional counseling. So we help you to eat better and to make better choices so that you're not constantly hungry, and you can prevent this cycle of hunger with weight regain, because you're going to be hungry, you're going to eat, and then you start regaining weight, and there's this constant cycle there, and there's a psychological aspect to it as well, where you start blaming yourself for it. But there's a physiological reason why this is happening. So we can help you understand this whole thing much better. And then in some patients, we also add medication to help people cope with this issue much better. So we'd like to see you for that. And then in a small number of patients, we can do revisional bariatric surgery as well, where we can revise the bypass. And when I first started doing the bypass, the biliopancreatic limb, as we call it, which is the part that is being bypassed from the small intestine, was very short. Now we make much bigger biliopancreatic limbs. So what we can do is we can easily distalize the bypass, which means make the biliopancreatic limb longer. This is a laparoscopic procedure, which isn't really a big procedure. It can be done, it takes about 45 minutes at most. And we usually send patients home the next day, and it's done laparoscopically. It's very effective in giving you additional weight loss. At that time, we can also consider other options, such as making the stoma smaller, or making the pouch smaller, and all these things do have an effect in weight loss and additional weight loss. We also have endoscopic procedures for making the stoma smaller. There is the one that used to be called the Rose procedure, or restorative obesity surgery endoscopic, and we can do that as well. We are certified to do that procedure. And those are things that we can discuss with you to make the stoma smaller, the pouch smaller, and maybe distalize. And those things can all be done at the same time for patients who've regained weight after a Roux-en-Y gastric bypass. So there are things that we would like to talk to you about if you are one of these patients who are having these issues. So we look forward to seeing you and discussing your options.